Welcome to this explainer. Okay, we're diving straight in today because we're unpacking some absolutely crucial cardiovascular insights from Dr. Terada. We're looking at a super specific, honestly pretty dangerous phase of healthcare, which is hospital discharge after heart failure. Now, going home sounds like a total victory, right? But as we're going to see, leaving the hospital is absolutely not the safe finish line you might think it is. Honestly, it's just the beginning of the real battle.
You know, I'm discharged, so I'm cured, right? This is exactly what almost every single patient thinks when they finally get to pack their bags and go home. And hey, it makes total sense. I mean, when someone is admitted for heart failure, they're usually in immense distress, struggling to breathe, totally unable to lie down comfortably, legs painfully swollen. Then they get hospital treatments, right? Diuretics, oxygen. The fluid drains, breathing gets easier, the swelling vanishes, they feel a million times better. They walk out those doors and think, hey, I'm cured. But Dr. Terada warns us that this is a super common and literally dangerous assumption. The symptoms fading? That just means your body's collapse balance was temporarily patched up. Your weakened heart itself hasn't magically been cured.
To really wrap our heads around this, we have to completely redefine what a heart failure hospitalization actually is. I was honestly stunned to learn that Dr. Terada considers this a severe red light warning. So being hospitalized for heart failure isn't just, a passing cold or a minor little glitch in the system. Your heart is the primary pump for your entire body. When it weakens so much that you end up in a hospital bed, it means it could literally no longer pump blood effectively to your organs. Fluid backed up into your lungs, which is why you were gasping for air, and it pooled down into your legs. Even your kidneys started to struggle. The entire systemic balance of your body just completely collapsed. That red light is a massive, flashing warning sign that your whole system is incredibly vulnerable right now.
Section 1. The readmission death spiral.
Okay, let's dive into this, because what actually happens to a patient right after they leave the safety of the hospital is genuinely alarming. Look at this medical data. Within just 30 days of going home, up to 25% of heart failure patients are readmitted. And by the 6-month mark, a staggering 50% of patients are right back in a hospital bed. To put that into perspective, that is actually a higher recurrence rate than a lot of common cancers. It really goes to show that simply going home does not mean your body is stable. It's a highly, highly precarious time.
So here's the absolutely crucial takeaway. Returning to the hospital isn't just, a minor inconvenience or a bump in the road. It's actively destructive to your body. As Dr. Terada highlights from the medical literature, every single time a patient goes back to the hospital for heart failure, it's not a reset to zero. Each crisis chips away at your kidney function. It eats away at your muscle strength. It degrades your other organs. I found it absolutely terrifying how Dr. Terada compares this to tumbling down a flight of stairs. Literally, with every readmission, you drop down another step in your lifespan. You just never quite bounce back to where you were before that fall.
Which brings us to our next section, the hidden trap of home.
So you might be wondering, if going back to the hospital is so damaging, why on earth are the readmission rates so high? Well, the answer really lies in the stark contrast of your environment. Think about it. When you're in the hospital, you're basically in a fortress. You've got doctors and nurses checking your weight every single day, your salt and fluids are strictly controlled, and every single pill is handed to you at the exact right second. But home? Man, home is full of hidden traps. It's a slightly saltier meal here, or maybe forgetting to weigh yourself for a couple of days. It's missing a dose of your meds because, hey, life gets busy. And heart failure is a disease where missing those early warning signs causes a rapid collapse. Those tiny, seemingly harmless deviations at home are exactly what trigger that deadly downward spiral right back to the hospital.
Next up, we are debunking the rest myth.
Now, this next insight completely shatters pretty much everything we traditionally assume about recovering from a serious heart condition. Since I have a bad heart, I should just rest as much as possible. I mean, I bet almost all of us would assume this is true, right? If your heart is weak, surely you shouldn't stress it. You should lie in bed, take it super easy, avoid physical exertion so you don't overwork the engine. It sounds totally logical. But Dr. Terada points out that this is actually one of the most dangerous misconceptions out there, especially for older adults.
Let me break down why absolute rest is actually your worst enemy here. If you rest excessively, your body rapidly loses muscle mass, especially in your legs. And when your leg muscles get weak, just simply walking requires significantly more effort, which, you guessed it, actually puts way more strain on your already weakened heart. Because your heart is straining, you get short of breath with just minimal movement. And then what happens? Well, you get scared of being out of breath, naturally, so you move even less. It's a vicious cycle. This just accelerates the muscle loss, puts further strain on the heart, and severely worsens the overall heart failure. So you aren't protecting your heart by staying in bed at all.
You are actively accelerating the disease.
Let's move on to our final section, 5 steps to protect your future. Okay, so we know the home environment is a bit of a minefield, and we know that staying in bed all day is, quite frankly, a terrible idea. So how do we break this cycle? How do we actually survive that false peak of hospital discharge? Well, Dr. Terada provides a super clear, actionable roadmap with 5 non-negotiable daily habits. First, never ever stop your medications just based on your own judgment. Number 2, you gotta weigh yourself every single day to catch that fluid retention early. 3, do not underestimate the danger of salt. Strict management is an absolute must. 4, never just sort of wait and see if you notice swelling, shortness of breath, or sudden weight gain. And 5, which is maybe the most critical piece of the puzzle that ties it all together, engaging in cardiac rehabilitation.
Let's actually define what cardiac rehabilitation is, because it's so much more than just, doing a few light stretches in a gym. It is a highly comprehensive treatment designed to rebuild your post-discharge habits and your physical strength. The whole goal of cardiac rehab isn't just to make you sweat. It is to fundamentally restructure your daily life. It's about safely rebuilding that leg muscle we talked about so your heart literally doesn't have to work as hard. It's about learning the exact diet you need. You are actively creating a body and a lifestyle that is highly resistant to being readmitted. It's basically your ultimate armor against that terrifying 50% readmission stat we looked at earlier.
As we wrap up this explainer today, I really want to leave you with this one thought. Discharge isn't the finish line. How will you protect your future from today onward? If you or someone you love is dealing with heart failure, please remember that walking through your front door at home is when the actual work begins. You hold the power to stop the readmission cycle, but it takes vigilance, it takes daily weight checks, and it takes proper guided movement through cardiac rehab. So what daily habit are you going to commit to changing today to protect your lifespan? Thanks so much for hanging out with me for this explainer. Keep learning, keep questioning, and definitely keep taking charge of your health.